Healthier Together, sponsored by Regence Blue Cross Blue Shield of Oregon.
In this week's Healthier Together, we're talking about kids and sleep. A healthy amount of sleep can reduce chronic disease risk, promote healing, and improve brain function. And today, we're focusing on new research from OHSU that's shedding light on how children's health, sleep, and trauma are intertwined. The research found traumatic events might exacerbate the effects of poor sleep on children's heart health. We talked to lead researcher and OHSU School of Nursing Associate Professor Ming-Kiao Song.
It is important for parents and also healthcare providers and also community in general that pay attention to whether children had experience in traumatic life events, and also want to check that, pay attention to whether they're getting enough adequate sleep, duration, and quality.
The analysis of more than 100,000 children in the U.S. found that more than 1/3 of them did not get the amount of daily sleep recommended by the American Heart Association. They also learned children ages 6 to 17 who had more traumatic experiences, as reported by their parents, were more likely to also have too little or too much sleep. The research included adverse childhood experiences such as witnessing violence, living with a person with alcohol or drug dependencies, abuse, and whether the child had any unfair treatment because of their race, ethnicities, or sexual orientation or gender identity.
It was as comprehensive as possible what they included of the traumatic event, what we call as adverse childhood experiences.
This new insight adds on to previous research that shows adverse childhood experiences and insufficient sleep are both associated with negative cardiovascular outcomes later in life. Song says pay attention to your child's sleep, and as a community, we need to ensure children are getting proper resources to address trauma.
Is there a way that they can talk to their parents or their primary care providers, so that if they already have some type of trauma events already, then we wanted to give some support.
So how much sleep does a child or teen need per night? Well, it really differs depending on age, ranging from 8 all the way up to 16 hours for some infants. We have a breakdown and more info on this research at kgw.com/healthiertogether.